Munir, a virologist at Lancaster University, joins us now to analyze all this. Mohammed, thanks so much for coming in on the show. Now, I do want to talk about this first comprehensive study that China just released. So the investigation found only 4.7% of the cases are confirmed critical. Around 80% are mild. So are people overreacting?
Let's explore this one a little further. So this study is not a new study. Is what it does. We call it descriptive study, where all the cases by 11th of February being collectively analyzed and consolidated, and a single figure has been put onto the analysis. So it seems like there is nothing new. What has been presented so far, we already knew that the overall impact of this virus onto the mortality is relatively low. However, it is more contagious, is spreading more easily, but the number of people in terms of percentage is significantly lower than the SARS or the MERS. But one thing that became very clear is that the number of people who have died in these 2 months or significantly higher is double than what has been killed by the SARS coronavirus in 1.5 years. So the cumulative impact of this virus is a lot more than what we have seen with the SARS.
Mohammed, as I just said earlier, China is reporting the decline, but WHO is warning that every scenario is still on the table. In your opinion, how serious is the situation at the moment?
Well, the situation hasn't significantly changed in last couple of weeks, mainly because, well, we do see that number of cases or the number of mortality fluctuate over the last 2-3 weeks, but the situation stayed the same. There are a few reasons for this one. The first thing, as you can probably anticipate, is that the people after the extended lunar year and after the opening of the school, they will be coming back, and there will be some sort of mobility within China. So that will also facilitate the spread of the virus. So the situation can change dramatically. At the same time, the diagnostic assays, those are being applied to detect the infections. Those always have a room for the improvement. So we have been seeing that China has a few discrepancies in reporting the cases the way it's coming every day. Sometimes it's higher, other time they are lower. And then there are questions about how they are going to really apply a consolidated assay that can detect all the cases in a more conclusive way.
And Mohammed, this study also points to the high risk for the medical staff. Now, how can the medical staff be more protected? What else can they do?
Well, that is a grim situation, really, because medical staff present the front line for any medical care. And it appears with this Wuhan coronavirus or the COVID-19 now is that the medical staff has been more vulnerable. And on my personal opinion, it's been mainly because the medical staff has been overwhelmed with this massive number and a big scale of this outbreak. So therefore, they are working extra time. They are taking less precautionary measure and PPEs, which are making them even more vulnerable. And this is really a gruesome situation for the health authorities because the system is already clogging and the number of patients are already more than what China could handle in a normal situation. Therefore, this is one of the critical points that all the health organizations within China should work very hard, and also the international community should support them.
Mohammed Munir, a virologist at Lancaster University. Thanks so much for your time and for your insight for us here at TRT World.